my name is Laura Bonilla. I am the Program Coordinator for the Maryland Rural Opioid Technical Assistance Project. We are pleased to welcome you to this webinar on the opioid crisis in Wicomico County and local responses. Maryland ROTA is part of an initiative by the Substance Abuse and Mental Health Services Administration, established by the University of Maryland in partnership with local and state organizations. Our project aims to strengthen the capacity of rural communities in Maryland by helping our communities identify, understand, and respond to the opioid misuse epidemic. Our multi-pronged approach includes delivering evidence-based training, providing current information and education, and strengthening youth against opioid misuse. For example, we encourage you to join our ROTA network to learn about best practices, ask questions of peers and experts, and share your local experiences. More information about Maryland ROTA and a link for joining our network are available at www.marylandrota.org. Today, we are excited to be joined by our two presenters from the Wicomico County Health Department. Our first presenter will be Christina Bowie-Simpson, Wicomico County Opioid Coordinator. She will be followed by Takeisha Collins, Wicomico Opioid Misuse Prevention Program Coordinator. This webinar will be approximately 60 minutes long, and we encourage you to submit questions during and after the presentation. Please do not raise your hand. Instead, we ask that you please post your questions in the Q&A box. We will hold a Q&A session after the presentation. We will do our best to get to all of your questions, and we will try to address any remaining questions after the webinar. A recording of this webinar will be made available on our website, www.marylandrota.org. You can find the webinar page under the Services tab. Thank you, and I hope you enjoy this webinar. Christina, I'll hand it over to you.
Thank you so much, Laura, and thank you to the entire ROTA team for having me and Takeisha here today to just share a little bit of information about the opioid crisis in Wicomico County specifically. As Laura mentioned, I am the opioid coordinator for Wicomico County. I have been with the health department for about 2 years, and I oversee a lot of the coordination and the planning for our opioid intervention team, as well as some new projects such as the Safe Station, which we'll talk about a little bit later, and the new LEAD program that we hope to implement coming up next year. A bit of background information on the opioid crisis, not only in Wicomico County, but the state and really the nation as a whole. In March of 2017, Larry Hogan, our governor, actually declared the opioid crisis a state of emergency. And what that really allowed us to do, allowed the state to do, was really implement more resources and funding so that we could address the opioid crisis with a lot of drive and really work towards, reducing deaths that we're seeing here in the state. The Opioid Operational Command Center also established the Heroin and Opioid Emergency Task Force, which really works to address certain goals, policies, procedures, and things of that nature. I'm not going to name them all, but they encompass a large number of things, again, that range from policy, law enforcement, trafficking, distribution of drugs, as well as, treatment and recovery services. So this heroin task force really addresses the opioid crisis and allows the state to focus much attention on helping to reduce the deaths that we see here in the state. The Opioid Operational Command Center works towards addressing 3 main goals or focus areas, and each of those focus areas have goals to work towards. So as you can see here, prevention and education, enforcement and public safety, and treatment and recovery are the main goals that the Opioid Operational Command Center really work to address. Also, here on the slide, you'll see down in the lower left corner, the Before It's Too Late logo. I do want to mention that this is a great resource resource before it's too late, you can visit their website. There'll be a link to that at the end of the presentation. There is much information, the annual reports you can find there, resources, PSAs that you can share on social media, as well as any of your other outlets. And we'll also show you each jurisdiction in Maryland's opioid response plan and what they are doing to address the crisis in their jurisdiction specifically. Also, we'll give you some different treatment resources as well. So to help the state reach those goals in those three main focus areas, the governor advised each county or jurisdiction in the state of Maryland to implement or form, I should say, an opioid intervention team. It is important to note that each jurisdiction's opioid intervention team is going to look different than others, and they allow that flexibility so that each county can really focus their attention on what they have identified as their main issues. Wicomico County's opioid intervention team specifically consists of 3 branches, each of which have different responsibilities, and each of these 3 branches meet monthly. The senior policy group is more of kind of the decision-making group for our county's OIT, specifically consists of our county executive, our health officer, as well as other elected officials in our area, such as the state's attorney and our sheriff. The strategic planning group mostly consists of directors of many of the local organizations and state agencies, such as the Narcotics Task Force, our local Department of Social Services, our college partners, Warwick Community College, as well as Salisbury University, and our state's attorney, emergency services, and other organizations as well. The operations group is a little bit different of a group than the senior policy and the strategic planning, in that the operations group is really what we consider our boots on the ground. Many individual agencies, such as our nonprofit groups, as well as the groups that have been mentioned previously, are all a part of our operations group as well. So as long as individuals are working to address substance use disorder or the opioid crisis in some way, we invite them to be a part of our operations section specifically. It is a great group. Anyone in Wicomico County that would like to be a part of this group, you are more than welcome to reach out, send an email. It's a great place where we, information share, as well as share resources. There's been a lot of connections made in this group. And just within the last year or so, important to note, is that we have another branch off of our operations section that is our Go Purple group. So Go Purple, again, I'll talk about that in a little bit, but our Go Purple group was just added on to the prevention branch of our operations section so that we can help raise awareness here in the county. So moving forward and shifting our attention to why we place so much focus on the opioid crisis and why it was deemed an emergency is just some of the statistics and the statewide deaths that we see here. Listed here, and the source of this was the annual report from the Opioid Operational Command Center, but this was completed by the state. You can see here, it was a steady decline for about the last a steady increase, I should say, in deaths for about the last 10 years. We've seen deaths climb at alarming rates and have seen certain substances such as fentanyl really be the culprit for many of the overdoses that are occurring not only in Wicomico County, but in the state as a whole. With that being said, this year, or last year, 2019 was the first time in over a decade where we were able to see a reduction in the amount of deaths that have occurred in the state. So we are hoping that we continue to see this decline as we move forward and as more focus has been made and more efforts have been placed on addressing the opioid crisis. So looking at Wicomico County specifically and the fatal overdose deaths, it is important to mention that the previous slide that included all overdose deaths, not just opioid related, but at this time the state has not released Wicomico, or I guess I should say county specific overdose rates, but they have reduced the opioid related overdose rates, which is what you'll see here. And if we look at Wicomico County in 2018 versus 2019, you will see that we saw a difference, reduction of 1 death, which is about a 3% decrease in the amount of lives lost to overdose. With that being said, our health officer has said many times that, 1 death in our county is 1 death too many, and we will continue to ramp up our efforts, enhance what we are already doing so that we continue to help those struggling and hopefully reduce the amount of deaths that we're seeing. So this slide here is our non-fatal overdose data. So again, this isn't specific to opioids. This is all overdose data regardless of the substance. This is, again, the non-fatal, and this data was given or provided to us by Peninsula Regional Medical Center, which is a partner of our opioid intervention team. You'll see that in 2017, the rates were extremely high. They were even higher the year prior to that. And then last year, 2018, there was 133. And then in 2019, 146. So really, it kind of fluctuates, but it is important to mention that, here in Wicomico County, it is very difficult to get an accurate count of our non-fatal overdoses due to several reasons. So when we look at this hospital data here, this is not going to include, individuals who never called 911 in the case of an overdose. Maybe they administered Narcan, excuse me, and they never called 911, or maybe EMS or law enforcement did respond, but for whatever reason, the individual refused transport to the hospital. We do, again, it is hard to really get a good idea of how many non-fatals are really occurring in Wicomico County. And we really hope to be able to kind of tackle that and look at ways to better streamline that information moving forward so that we get a better count. We could use EMS data. EMS data, though, would also kind of be not all inclusive in that we are one of the only counties left in the state of Maryland who are on an independent kind of system. So each EMS company here in Wicomico County can choose whether or not they would like to share their overdose data with us. And at this time, we only have about 5 of the 12 companies who do share that data. So as I mentioned before, we are really working on trying to figure out how to get a better idea of this these non-fatal overdoses that are occurring in Wicomico County, but we are certainly grateful for the data that we are able to receive from PRMC. So when we look at the overdoses that are occurring, certainly there is going to be a lot of different ways that impacts our community. Loss of family support for the individual, the increase in treatment needed cost. We have seen somewhat of an increase in crime, increase in cost to the criminal justice system, lots of different ways that this impacts the community. And it is important to keep this in mind, but also really important that we understand, what an impact that it has on the individuals that struggle with a substance use disorder, as well as their families and their loved ones. What I really like to highlight and what I really like to discuss is what we are doing here in Wicomico County to address the opioid crisis and really substance use disorder as a whole. All physicians utilize the prescription drug monitoring program, where they are able to log into a system and see what medications individuals have been prescribed opioid prescriptions, that is, and really be able to track and be able to monitor what prescriptions an individual are getting. Recently implemented as well, Michelle Hardy with our local behavioral health department is trained to be an academic detailer. So she is able to provide information to physicians and providers in our community about the opioid crisis and prescribing practices, and also offer them a lot of resources as well that they may not otherwise be aware of. We also hold monthly overdose fatality review teams where we look at each case of someone who has unfortunately passed away due to an overdose, and we're able to look at, you know, trends and maybe ways to moving forward that we can focus our attention on and address the common themes that arise within those meetings. We do community naloxone or Narcan trainings. Typically, we do those every Tuesday at the Wicomico Public Library, but since COVID has kind of hit, we are unable to do those in-person trainings. During this time, though, we are able to offer over the phone trainings that we have, and they will, or the COAT team, I should say, excuse me, will deliver Narcan to an individual's home right now. So it is contactless Narcan delivery. Also, we have looked into treatment expansion initiatives. We were able to partner with Hudson Health, which is our residential treatment provider here in Wicomico County, to implement a crisis house. Unfortunately, that crisis house shut down the end of March, but we do hope over time that we can continue to expand the treatment that's offered here in Wicomico. Also, we have 11 drop-off boxes for prescription medications at 10 different locations. I'm not going to touch on that too much because I know Takeisha during her presentation is going to provide a lot of that information to you. Our community outreach addictions team is really another extremely valuable resource that we have here in the county. The opening of our Safe Station, which has been great, and I'll discuss a little bit more in a future slide. And then more education on safe storage and disposal of medication. Also, really exciting is that the application for our syringe service program has been approved. So we are planning to open a harm reduction center, which will be called the Shore Center. And, you know, oftentimes there's a lot of mixed feelings regarding syringe services, but it is important to note that this will not be the only services or service provided at the Harm Reduction Center. We will also do Narcan trainings, provide condoms, referrals to treatment if the individual would be interested. So it really does encompass a lot of harm reduction services and resources, and not just the syringe service as well. Planning of a law enforcement assisted diversion program. So hopefully we will see that implemented sometime early next year. The Wicomico Goes Purple awareness campaign that we just launched last year, which we have seen a lot of movement and a lot of excitement around. We've had a lot of businesses in our community who have really kind of wrapped their arms around that and have really been in support, as well as our local OIT partners, community members, and we will continue to have Wicomico Goes Purple in September of this year. Our kickoff event will hopefully be in August, but it may look a bit different this year just due to COVID and what restrictions we are going to see once we move into the fall. Family support services that are offered by our OIT partners as well. One in particular is the Maryland Coalition of Families. They are a great resource for anyone who is a family member of someone who is struggling with addiction. They are peers who have traveled that road, and they are really available to help any family members. They hold support groups. So again, if you would like to reach out to them, if you know someone in need of family support services, that is a great program. our Overdose Awareness Day event. This year will be our 4th year having that event. And we are planning to make that a tri-county event this year. So that's also growing, hopefully to incorporate both Somerset and Worcester County. Education on the Good Samaritan Law, which again, I'm pretty sure Takeisha is going to discuss that later on. So I'm not going to touch on that. But we also have medication-assisted treatment options, such as methadone, Suboxone, and Vivitrol. Again, we formed our opioid intervention team to really allow for a lot of focus to be placed on addressing the crisis. And then also some peer support services that are offered at our detention center, which we have really been able to identify is a very important piece of the puzzle. Those who are being released from the jail are at high risk. So having that peer to walk beside them as they're being released is quite a valuable resource that we have here in Wicomico. So as I mentioned in the previous slides, we were able to implement our Safe Station here in Wicomico County. We implemented it on August the 1st, and it is a 24-hour program, or a 24-hour resource that individuals can access. So 24/7, there is someone there. If an individual decides, hey, I am ready for treatment, they can go to the Recovery Resource Center, which is located right in Salisbury behind the Wawa, and they can say, hey, I'm ready for treatment. We found this program to be extremely successful just through August to March of this year. The COAT team, which is our peers in recovery, were able to serve 133 individuals, and we're able to link all but 7 of those to the treatment services of their choice. So that is important to mention, is that, you know, self-determination plays a very large role. So having 24-hour access is a great resource to be able to have, because if someone decides at 2 a.m. that they are ready for treatment, at 2 a.m. we need to be ready to meet them where they are at. So again, if anybody has questions about the Safe Station, please feel free to reach out. Tasha Jameson and myself have done a lot of planning around this program and would love to help anyone or provide any information to anyone about the Safe Station. I did want to note that during this time with COVID, the Recovery Resource Center is still closed for meetings, but the Safe Station can still be accessed, or you can call the COAT number, which will be in a later slide, and they will speak with you over the phone, and they have been successful in linking individuals to treatment since the COVID-19 pandemic has started. So if an individual wants to go, someone will be there, but if it's easier for an individual, they can also call the COAT team, and the COAT team will help link them to the services that they would like. Here in Wicomico County, I'm not sure you know, that individuals realize that we do have a lot of different agencies that are working to help individuals who are struggling with substance use disorder, whether that be opioid use or any substance use. Medication-assisted treatment is inpatient or residential treatment, recovery and transitional housing. We do have resources here. This is our Tri-County Behavioral Resource Guide. The local behavioral health authority does work to create these every year in partnership with our neighboring counties. And these, you know, if you need help accessing or finding information about, you know, what treatment providers there are, you can visit the Wicomico County Health Department website, or you can also reach out to the local behavioral health authority, and they will help share the information with you on what agencies are here in Wicomico County and where treatment can be accessed. So just some online resources here is wicomicohealth.org. Like I mentioned, Wicomico does offer behavioral health services at the health department, but there are other agencies as well in the area. But if you visit wicomicohealth.org, it will give you information about our behavioral health program specifically, but it will also provide you information. There is a link to the behavioral health resource guide, as well as links to each of the various programs, such as the Community Outreach Addictions Team. And there's also some information about the Opioid Intervention Team that can be found there as well. And some important phone numbers. If you want to call the health department for whatever reason at any time, you can access the phone number and other contact information by visiting that website. Also the WicomicoGoesPurple.com website. We also have a Facebook page. This website is really great. We post resources here as well, treatment resources, as well as a place where you can go and book our Opioid Intervention Team educational trailer. So the trailer is, it was implemented last July, and that can be taken out into the community. It's a simulation of an adolescent's bedroom. We take parents and caregivers on tours through that trailer and help them recognize where to maybe look in their child's room for any types of substances, or what signs and symptoms to look for that may indicate that their child may be using. So that resource, the educational trailer, can be booked by our community as well. And we would love to come if you are planning an event or hosting some type of event at your agency or organization. We would love to come be a part of that. We set up a resource table out front as well. So a lot of good information you can find there. So again, if you want to book the opioid education trailer, you can visit the Wicomico Goes Purple website to do that. And lastly, the Before It's Too Late Maryland.org. I mentioned that in one of the earlier slides, but it is a really great resource where you can find a lot of information that will be helpful for you. Lastly, just please remember that there is 24/7 accessibility to our Community Outreach Addictions Team. If you or someone you love is struggling, please reach out. There is someone that is there to help you. They are a peer specialist. They have been through these experiences, this experience with addiction, and they really do work with individuals and help link them to treatment and meet them where they're at. This may be one of the most valuable resources that we have here in Wicomico County, and we are very, very lucky to have them. So please jot this phone number down and feel free to reach out to them or provide that to those that you may be working with. But that is it. I thank you so much for your time today. I truly appreciate you tuning in. Thanks to Rhoda for reaching out and asking. And I'm actually going to introduce Takeisha Collins, who is our Opioid Misuse Prevention Program Coordinator. We have a lot of acronyms, so if you ever hear OMPP, that is Takeisha and the program that she coordinates. And she's going to be talking about what she does over in that program. So again, thank you so much.
Thank you, Chrissy, for the introduction. Hello, everyone. My name is Takeisha Collins. I am the Opioid Misuse Prevention Program Coordinator in Wicomico County, also known as OMP. I've been with the department for almost 5.5 to 6 years, and I've been working on multiple strategies in the county that I will share with you guys today, and information that may help you find or help you utilize during or in your county or during our setup of a program that will help you reach people to prevent opiate misuse. During the presentation, the objectives are to gain knowledge of prevention programs in Wicomico County, program strategies from the past. I will review what we've done in the past and what we're currently doing now, to learn what our county is doing to prevent opiate overdose and minimize public exposure to prescription drugs, and our successes and some of our challenges. Next slide. The Opioid Misuse Prevention Program, also known as OMPP, it was a part of the comprehensive state strategy for reducing overdose deaths related to pharmaceutical, opiates, and heroin. It was started and established in 2015. It started rolling and we started implementing our strategies in 2016. The grant and health department staff work closely with stakeholders across the region to reduce unintentional overdose involving opiates or prescription painkillers and heroin. Me, as a coordinator, provide outreach, education, and training to individual work sites, community groups in Wicomico County. At the present time, we have 18 jurisdictions in Maryland, including a North Shore regional that consists of at least 5 counties, but they're under one regional team, and they have their own coordinator for that team. And that we all have submitted our strategic plan and are currently working on a 4th step of our SPIF process, which is the implementation process. The evidence-based strategic plan activities being implemented include, this is all of the counties in a collaborative, not just Wicomico: prescription dispenser education, PDMP awareness, media campaigns, youth education regarding risk and health and opioid misuse, public awareness of the naloxone and the Good Samaritan law, drug take-back events and drop-off boxes, disseminating lock boxes for parents and senior citizens, expert training for law enforcement and first responders for users and treatment. If you want more information on how to perhaps start an opioid misuse program in a rural area or a county, you can go to the link below and it will give you the steps and contact information on how to start that process. In the past, the strategies worked on were public awareness of the Good Samaritan law, helping pregnant women seek treatment to avoid neonatal abstinence syndrome, opiate dependent develop materials, training opiate staff, training mothers and delivery staff, SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment, which is a brief survey that medical staff can survey a person when they come in for either an OB appointment or in the ER to determine if they're at risk to developing a opiate abuse problem, or there are some key flags that could indicate that they could be at risk to becoming addicted to opiates. We educate providers and dispensers on we have in the past, before it became a law, it was a mandate or a mandate. We were educating pharmacies and other doctors, other offices and agencies that are medical on the PNMP to prevent doctor shopping from county to county or even state to state links, so you can keep a track of what is being prescribed, and also you can keep track on what people are getting access to. Encouraging prescribers to enroll in the PDMP by providing training, technical assistance, working with pregnant women. So currently now we're working on raising further public awareness on the Good Samaritan law. We conducted focus groups and surveys in the community to gather information on how to better get the information out there that will reach the community, not just based on how we think the message is being conveyed, but getting some feedback from the community on how they were seeing the message. And in the past, they said the messaging seemed non-personal and it seemed kind of more law enforcement or punishment based. So we changed our PSAs and our flyers and our information based on their feedback. So it will better reach our target populations or high risk population, or in general, just reach the community in a better way, in a more positive. We use a more friendlier approach, more human, more down to earth, instead of and talking about the consequences of things that could happen. We educate women on childbearing age. In the past, we were educating them on treatment options, but doing our focus groups and our surveys, we found that they felt, especially the ones who are in recovery, that they didn't have enough support or skills on stress management or coping skills. So now we focus on more relapse prevention. Increasing community knowledge on proper storage and disposal of medication, and I will share a little bit of that later. And we also raise public awareness on substance use disorder. That's a new strategy that we added on to eliminate or minimize the stigma that's associated to substance use disorder, and change the terminology from dope fiend or negative connotations that it has, or instead of calling them abuser or user, we modified our terminology to substance use disorder, getting the information out there that it's a disorder, it's a medical term for the disease that they have or the disorder that they have. So when you make it less negative and more positive, maybe more resources will open up to provide treatment or healthcare and things of that nature. The ways we collect our data to assess what the needs of the community are. We do surveys, and also to get information out to the community. So it can saturate the community in different, we try to saturate the community in different ways by PSAs, billboards, flyers, postcards, posters, safe storage and disposal presentations I conduct showing safe ways to get rid of your prescription medication if you're in a rural area, such as in your trash cans, you could get rid of them with coffee grounds or kitty litter with water and mixture in a Ziploc bag and throw it in your trash can so it looks less desirable to the community and someone wouldn't access them to be abused, or perhaps taking all your medications that could be potentially abused and put them in lockbox and in a disclosed place where it's not obvious or no one can get access to them. We conduct anti-stigma forums and workshops, and we also promote what we're doing on our incentives. I like one of our promotions is Hearts and Hands taking a stand against opiate misuse. So giving catchy slogans to get people to want to ask questions or to inquire more about what we're doing. This is a survey that I conducted of 40 people when we're trying to figure out which avenue was the best way to advertise our information. And it gives, billboards was on 13 people had only seen our brochures, had the most, and pamphlets had the most views. They was 20. Radio ads was 9. TV ads was 18, and web was 12. We are currently working on another survey to see if those numbers have changed, to determine if the methods that we're now utilizing are being successful. So we found out some didn't know about it and the other routes, but word of mouth I found also, I've heard during the surveys that they were getting the information through a person-to-person transaction. Next slide. We have a PSA. If you visit the wicomicohealthdepartment.org that Chrissy shared earlier, you can go to the specific department. If you copy and select this link, you can go directly to the Opioid Misuse Prevention Program page, and you can see some of the PSA or the PSA that we're currently running on the Good Samaritan law and also safe storage and disposal. Next slide. Here is one of our billboards that was up for about a month and a half, and it was encouraging people to call 911 because in the county at a certain time, people were scared to call 911 because they were fear of being persecuted or locked up. So they were dumping bodies, and we were finding people that had passed away from the overdose, which could have been preventable if someone had utilized the 911 emergency system. We also make custom flyers. We do prevention. It's a place called Prevention Press. If you're interested in getting stock cards or flyers or brochures from them, they're pretty reasonable price, about 33 cents per flyer, and a little more if there's a different setup like a stock card, maybe it'll be a little bit less or a little bit more. We work with Journey Works, and they have good informational flyers that they provide, and we purchase as well. I did canvas flyers for mothers, and we try to be really diverse. So I had one made in Spanish and make sure it represents all ethnic backgrounds, which is Spanish, African American, and Caucasian, with the same message to convey. So, because addictions faces are different, and everybody, you can't tell a book by its cover. And most of the time it seems like it's targeted one population, but everybody is being affected by this disorder, this opiate epidemic. Chrissy touched on our drop-off boxes earlier in her presentation, but this is our safe storage and disposal awareness avenue that we're taking. We do not in our county participate in take back days, because now we have the drop-off box and every day can be a take-back day. We have 11 total drop-off boxes, 5 in law enforcement, 2 in our local hospital, and 4 in various pharmacies throughout of the county. And according to we also teach according to the EPA standards. They prefer not to flush, and they prefer you to use one of the other the methods I just discussed previously, the drop-off boxes, or get rid of them using water and coffee grounds or cat litter and dispose of it in the trash can. They don't prefer you to flush your medications down the toilet. And also to return unwanted and expired prescriptions, over-counter drugs that, like I said, if you have a take-back day, or do it in a drop-off box. Here's another postcard that we use to show our locations. This is the Wicomico Sheriff Department, Delmar Police Department, Fruitland Police Department, Salisbury Police Department, and the Maryland State Barracks. We also have collaborated with Apple Drug, provided them with a drop box, PRMC, our local hospital, and Mount Herman Pharmacy, Pemberton Pharmacy, and Cheyenne, and we try to strategically spread out the box locations so it's accessible to many. Unfortunately, we have some counties that are extremely rural and they don't have a pharmacy, so we utilize other methods to help assist them to get rid of their medications, as is, you can mail order, you can drop them off in the mail. The UPS has a system now, it's called Seal and Send. That's also through Sharp. And there are also other mail-in methods to get rid of medications. They can run quite expensive, so the presentations I conduct are geared towards free, non-expensive ways to get rid of opiate medication if you're unable to reach a drop box. And here are further efforts we're helping. I became trained to train as a Narcan trainer to train people on administering Narcan. As I discussed, we use flyers and incentives and brochures, community participation. We go out in the community and participate at the library. As at the lower corner, you can see where it's Wicomico goes purple. We collaborate with those, and we have a table in our local library, which unfortunately during COVID, can't access it now, but when things open back up, there's a table there that has resources from different programs and from us on ways to get rid of medications, the dangers of opiates and heroin, fentanyl, etc. And also, as I discussed earlier, we do storage and disposal campaign and educational presentations. And there's samples of the forms. We had one anti-stigma workshop called Stigma Stains, Let's Wash It Out. And I had another one that was the many faces of stigma. There was a forum and it had a panel that of different people from different agencies that discussed in their view, and it was a question answer session where you could ask questions and they would answer what they're doing in their agency to help with stigma when it comes to this disorder. Some of our successes were we established new locations for prescription drop-off boxes. Formerly, when I started, there was 1. Then now for pharmacy, now there's 3. the law enforcement was the first ones that were established, so that was a good effort. That was prior to me starting. Cindy Schiffler is my colleague. She's a prevention coordinator as well, and she works in helping with the same things when it comes to the opiate disorder, of getting rid of medications, and education on safe storage and disposal, and what the consequences of abusing your prescription medications or opiates. We were successful in the anti-stigma workshop for professional people recovery. We're educated and helpful indicated by posting flyers. So we were successful on spreading the word with the anti-stigma information. Often our forums were full to capacity. We had waiting lists, so I was happy to know that a lot of people were interested in the workshops. The success also, we collected over 1,000 pounds of medication since the time the drop boxes were established. So that's a success, and we were given a certificate from Sharps for collecting over 500 pounds of prescription medications. The challenges, the lack of interest outside of agencies to collaborate, hosting support groups, and sharing data. With one of our strategies, it was a lack of interest for some agency to share data, and also community interest in starting support groups for the ladies that needed further assistance in their recovery, such as the parenting classes, and we can't do support groups, for support groups that will help them give them parenting skills and coping with stress other than using a substance to do so. Lack of participation in focus groups. We conduct focus groups occasionally, and the participation is lack. We don't know why that is, or maybe people just feel like their voice doesn't help. So we're trying to get rid of the stigma, so then they'll feel more comfortable coming out, sharing their opinion to help us help them better. The lack of interest in outside agencies to collaborate. A force group, that was a repeat. Lack of interest in parts of doctors evaluating using screening methods and referrals. When we were trying to start the expert here, it was hard for us to implement that portion of our strategic plan, because a lot of doctors and a lot of agencies, many of the agencies felt that they have their own screening technique and was working, even though the numbers of opiate at the time opiate abuse were increasing and death was increasing. I have some helpful resources here, YouTube videos for those who do present information to groups of people, especially in the rural community. If you have community groups and you're planning things, these resources can be very helpful. It talks about how and why people become addicted to medication and how it works. And I show them during my presentations, and I get pretty positive feedback. And that's the conclusion of my presentation. If you have any questions or you want further information on any information I shared today, feel free to email me at takeisha.collins@maryland.gov. Thank you for your time and your attention.
Thank you so much, Takeisha and Christina, for your presentations. We will now begin the Q&A portion of this webinar. We encourage you to post any questions in the Q&A box. The first question came during your presentation, Christina, and it says, I was under the assumption that within the goals, there were specifics related to syringe services and harm reduction.
Yeah, so this actual photo or I guess maybe infographic was taken directly from the OOCC's annual plan, and that is what was listed in this year's annual plan that was or last year's annual plan that was just released. With that being said, I do know that the state, so the Maryland Department of Health, is very supportive of harm reduction services as well as syringe service programs. And then there's also, now there's the Harm Reduction Center. So I do know that the state is very supportive, as well as the OOCC, in implementing harm reduction services throughout the state and making sure that those are available.
how many hospitals operate in Wicomico County?
In Wicomico County, the only hospital that we have is Peninsula Regional Medical Center. And the next, I guess, closest hospital would be Atlantic General Hospital in Berlin, but that's located in Worcester County.
What are the county level sources of data to assess community impacts such as those you listed?
Yeah, so if I'm thinking correctly, that is the community impact slide that we had, and I believe that was a report that was done through Beacon at Salisbury University. I'm not 100% sure, but I can certainly look in and try to find more information about that.
Takeisha, this question came in during your presentation. Have you had to alter your take back or drop off strategies as a result of stay-at-home orders during COVID-19? If so, in what ways?
Well, no, we have not altered our take back strategies during the COVID. The most thing I've been pushing was the way you dispose of your medications at home. The boxes are still accessible in the police departments, not so much in the pharmacies, but they could still go to the police departments that are listed if they felt safe. If not, the best method is to get rid of it at home. On our grant, once the strategies are submitted, altering them, we're not allowed to till the next fiscal year when data provides that we need to alter. So I've been listing information on my opioid misuse prevention page on efforts to get rid of your medication through home disposal during this time.
I also know, just to add to that really quickly, doTERRA is a company. They have medication disposal bags, and I do know that during National Prevention Week on their Facebook and website, you could reach out and they were sending out free medication disposal bags. So I do know that the company in general during this time has tried to accommodate and make it easier for individuals to dispose of their medications.
Can you define safe station?
Sure. So a safe station is a safe place where an individual can go who is struggling with addiction 24 hours, 7 days a week, and be met by compassionate and empathetic peers that are in recovery themselves, who will work to link them to the treatment resources of their choice. So like I mentioned, the safe station is a place where someone can go if they're seeking treatment services. There is oftentimes a little bit of confusion when you see the safe, because there's also safe injection sites that are beginning to kind of pop up throughout the country. But it is important that people know that this safe station is not a safe injection site, that it is where an individual can go if they are ready to seek treatment for their substance use disorder.
Are faith-based institutions tapped to support your efforts in any way?
Is this in specific to Takeisha's program, or just faith-based as far as addressing the opioid crisis in Wicomico County?
Well, I can answer. We do deal with churches and do presentations for safe storage and disposal and educating on the opiate crisis. I work with several churches through referral or directly contacted through email in the community. They invite me to come out and speak on either the topic of safe storage and disposal or my program in general, or opiates and what's going on in our county.
Yes, and in addition, we have faith-based organizations who also are part of our opioid intervention team. One of the churches in our area actually hosted an opioid forum last September for Wicomico Goes Purple. Also, the Go Purple group has a whole faith-based kind of subsection. So they were able to plan a night of hope and prayer out in the community. I know that I've done Narcan trainings at several churches in the area. So our faith-based community is, I feel, supportive. and working to address the opioid crisis as well. And then we also have many churches in the area who host their own Celebrate Recovery programs. So that's helpful as well for individuals who may want more of a 12-step group, but that is Christian or faith-based.
And we also have a coalition called Drug Free Wicomico, where they welcome faith-based community members to join as well. It's on Wednesday, the third Wednesday of each month. Oh no, I'm sorry, excuse me, the fourth Wednesday of each month at 11 at Comcast, but now we're not having those, so I don't know if we're gonna either start doing the video chats, but the head of that one, her name is Cindy Schiffler. And so they welcome faith-based community members as well as OIT, as Chrissy said. Most of the programs or coalition or the teams we have welcome faith-based. We try to basically encourage that as well.
Do you or how do you leverage or use social media platforms other than Facebook to get your message out? And Takeisha, this is addressed to you.
Well, I have used Instagram, and now we're trying to look into geofencing, where it's more targeted messages that will pop up on social media or digital devices. We're trying to conduct most of our surveys using that platform as well, of not just Facebook, Twitter. Drug Free Wicomico has a Facebook account. We do Twitter. I'm not sure if we do Snapchat, because there's another person on our team that deals with the social media portion, but I believe on Snapchat as well.
Do you know when the Shore Center will open?
So we really hope that that will open soon. Again, with the whole COVID-19 crisis that we're in right now, we have been somewhat delayed in being able to plan and get the center together. I do know that we have some staff that are inside of the center now, and we have the building. So we hope as soon as we are able to return to the office that the planning will be able to kind of be kicked into full gear, and that we will have the Shore Center up and running.
Do either of the programs reach out to the universities in the area to get the message out or help with your efforts?
Well, I deal with Warwick and Christy.
So we are actually Warwick Community College as well as Salisbury University, which are our two colleges in Wicomico County, are both fully engaged. The Board of Education sits on our strategic planning section, as well as attends our operations group, the Board of Ed, as well as Warwick, as well as Salisbury University. So they're very engaged in the opioid intervention team, and there's a lot of partnerships there. We brought the opioid intervention team trailer last year to both of those colleges to help provide information to the students. Warwick lit their fountain up purple to support Go Purple. Salisbury University lit their tower up purple, made purple, those purple t-shirts. So our local colleges and universities are very supportive in trying to get the message out to the students, and we're very grateful to have them as partners here in Wicomico County.
Yeah, and they also have invited us to several of their health fairs, community fairs, to give out information, to do short presentations and Narcan trainings. And one of my she's part of the OIT. We do little, she said the little business cards, they put messages on, and she puts them in the bathroom for people, and it's been very successful. She started that with us to get out information to the students in a discreet way that it doesn't bring any attention if anybody is inquiring about information on opiates or intervention or treatment, prevention, intervention, and treatment.
Yeah, and that is, I don't know if there's anyone on here from any colleges or universities outside of Wicomico County, but her name is Penny Walters, and she's the counselor at Warwick Community College. And these business card bathroom initiative that she has been very successful, and she's been able to give out a lot of different cards on different resources. So whether that be our community outreach addictions team, the Safe Station, 211, suicide prevention, you know, anything mental health or substance use, she places these business cards in all of the bathrooms on campus. And like Takeisha said, they can take them and nobody's looking. So there's no attention there. They can kind of do it in private and get that help that they need.
And the Good Samaritan Law was one of them as well, drop-off box locations and information on the substances themselves.
Okay, thank you so much. It looks like there are no other questions. So thanks again to Keisha and Christina. Also, thank you to everyone who attended, and we hope to see you in our future webinars, and hope everyone has a great rest of their day. Thank you so much.
Thank you for having us.